Welcome back, broadcasting from Alexandra Township this morning on this Tuesday morning, and we're at the Yexcape Park on the east side of the east bank of Alexandra, and this is an area that is plagued by many problems, many issues. But having said that, it's also an area that has a very rich history that we have heard about, talking about around about 900,000 people living in 1 square kilometre, and you can imagine what results in something like that. Before the break, we were speaking to Delene James, talking about the situation when it comes to drugs. Joining me now is the Premier of the province of Gauteng, and Nomvula Mokonyane, as you do know her. Premier, it's so good to have you. Welcome to Morning Live.
Hi, thanks, Leanne, and morning to the viewers.
Desperate mother. We're all mothers. We know the feeling. We can understand what Delene is saying. And she's just saying that she feels the province is not doing enough when it comes to drug abuse and fighting drugs. What is your response to something like that?
I think we are better than what we were before. I've heard what Delene was raising. The good thing, even in Eldos, is that many of the communities are now working together. Everybody, we've got an anti-drug community forum where stakeholders are in it. 2, we have also identified some of the lolly lounges. What continues to be a challenge is that there are people who continue to allow space for drug pushers to operate, but we have cleaned drug proliferation in the schools. We have cleaned drug distribution through our kids, through abandoned buildings of government. What continues to be a problem is what we must work on together with communities, where people still continue to work together with the drug lords. But I also think there has to be an appreciation that with the work that we did in El Dorado Park and we continue to do in Gauteng, we have also been able to lobby government nationally that Nyaupe must be registered as an illegal drug. We've dealt with that, and that for us takes us somewhere. What we must continue to do is to mobilize society, because the government has actually put a lot of programs. We've even taken kids from El Dorado Park, put them in a rehabilitation program where skills development, placement with the private sector, including the work that we are doing in terms of the West Rand College, where they are actually being given a second chance in life. Yes, we will not be able to say 100% things are normal. The situation requires continuous interaction, but it also calls for unity and collective effort in the community, which we'll continue to do.
Yeah. Premier, I think you are right. I mean, it certainly is something that it can't be changed overnight. It is a big situation. It's been around for years, and it will be around for years to come. But one of the things Delene was saying is that she feels that hospitals are not equipped. You know, one of the hospitals that is Baragwanath, but you cannot even get in there.
Remember, the fact of the matter is that they were not designed to deal with these things. You need properly constituted rehabilitation centers. What we have done in Gauteng, we have now opened at least 20 beds in every hospital to accommodate children who are going in there. And the important thing, it's not about taking the child to go and clean in the hospital. It's about cleaning the community, so that when the child comes out of or whoever is a patient, because these are patients, some of them, they must actually go back into a society that has been cleansed. We are now even working together with other stakeholders in the whole of the province to set up different support groups. We have some that are already working even in the El Dorado Park area, linked to other groups like Busasa in the West Rand, where we have diversion programs. And I think the solution is not just the medical intervention, which was missing. Remember, now we have an anti-drugs master plan, something that never existed, and hence our health facilities were not responding. They are now responding. We have forensic social workers that are also helping us. And of importance is that the system itself was not geared to deal with this thing. We're turning the tide on the system. The fact that Nyaupe now is being registered, the fact that we've got 20 beds in every major hospital, the fact that we've got social workers who are placed, the fact that we move beyond just rehabilitation in terms of cleaning the system to skills development, to placement programs, to parenting and community participation. Those are the most important things. But we'll get there. Community effort, unity of the affected is quite important as well.
All right, the Premier is going to stay with us, and we'll continue to talk about other issues. That was just the issue of drug abuse here in the province. There's so many other issues to talk about. 7:10, Premier staying with us then. Let's quickly take a break, because I know we've got to get the news.